Awesome. Hi, everybody. We'll be starting in a couple of minutes. We'll just let everybody kind of trickle in, but nice to see lots of people have joined already. I think we'll probably start by, I want to try by 5:04. We'll see how many people are in. Okay.
So where are you guys right now?
Is it us?
Yeah.
The team? Oh yeah. Dia and I are in New York. We work out of an office in New Union Square, if you know where that's at.
Cool. That sounds awesome.
Mm-hmm.
Hi, Dr. Singh.
Oh, hi. Yes, I'm in the Kitchener-Waterloo area.
Okay, we'll get started. We'll give it one more minute. It looks like a couple people are still trickling in.
Hi, Ray. Some people are texting me that they actually registered for the event, but they didn't receive a link. I'm not sure what happened there.
I think when you register, you get the email sent to you automatically, but do you happen to know who it is or who's trying to get in?
So yeah, let me see. There was a Dr. Costin. And Dr. Mira. I'm not sure what happened there.
Okay. I can see. I'll just send them a quick email really quick. Hopefully they're able to join. I just sent the link. I'll also actually just post it in the chat too, in case anybody gets some colleagues asking to join. You can always just pass them this link and they can just join it directly. But in the interest of time, I think we'll get started, and then some people will trickle in. The session is being recorded as well, so anyone will be able to view it afterwards. I think everybody who registered as well should automatically get sent the recording as well. But we'll see how that works. That's my first time doing the webinar version for Microsoft Teams. Yeah, no, thanks everybody for joining us today. I'm really excited to have both Dr. Wilson, local family physician, and we have Allegra and India from Heidi Health as well to host this presentation. We have a lot to kind of get through. So we have, I'll just kind of pop us into the agenda here. But I'll start with some introductions and welcomes, which is sort of what we're doing now. We'll get into just an overview of Heidi itself. And then we'll have, I think, kind of the meat and potatoes of the session today is Dr. Wilson, how to use Heidi in a clinical practice, and some helpful kind of tips and tricks on how to use the platform, as well as we'll have a chance for some questions and answers, and a couple closeout next steps for folks if they haven't been set up yet and want to get set up, or have any other additional questions. So that's sort of the content that we're going to run through today. For those of you that might not know myself, my name is Raymond Dolch. I'm the digital health lead of the Cambridge North Dumfries Ontario Health team. And again, very pleased to be hosting the session today as well. So I just want to provide a little quick overview of the AI Scribe project that the Cambridge North Dumfries OHT embarked upon alongside the primary care network. So we've procured an unlimited enterprise license with Heidi after it seemed like a few months of kind of going back and forth, seeing what AI Scribe vendors were available, which ones kind of offered the best deal, also which ones had the best functionality. We landed on Heidi based on clinician feedback on this is their preferred tool to use. And so we signed an agreement with them, and we have an unlimited amount of licenses to share for clinicians practicing in CND OHT, including physicians, nurse practitioners, RNs, RPNs, allied health, and much more. And these licenses are available from this March all the way till next March. So the full fiscal year, which is awesome. I also wanted to share a couple stats because I thought this is actually pretty amazing since we started. We've already have saved over 1,100 clinical hours with just being live for just over 2 months, which is kind of crazy to think about, not just from like a monetary perspective, but just about clinicians. This is hours of clinicians being able to go home at the end of the day to see their family, spend time with their family, not have to spend 1,100 hours on documenting things in their EMR. So it's really great to see. And of course, beside that, so how those hours are saved, it's well saved through 2,200 weekly sessions that we're seeing across all the different users, and over 3,000 different weekly notes being generated, which also means people aren't just using Heidi for just the summarization of the note, but they're actually using the features that Dr. Wilson and Lycra and Dia will talk about. That's included within Heidi. So really awesome to see this. Really excited to have people using Heidi. And I think with that, we'll pass it off to Allegra and Dia to talk about what Heidi actually is. Thank you, Raymond. Appreciate it. Lovely to meet you all. If we haven't met before in some of the other sort of larger training sessions. I'm Allegra. I lead customer success for North America for Heidi Health, and Dia, my colleague here as well, joins us to answer some questions. We're super excited about this project, and just from looking at the stats as well, the sort of impact in just a short 2 months is really great to see. I imagine this sort of a mix of knowledge around Heidi and AI scribes in general across the group. So I'll just give a quick overview, and then once Dr. Wilson gives the demo, I think it'll answer a whole lot of questions as well, but we can always do a Q&A afterwards as well if you have specific questions. So what is Heidi? It's an AI medical scribe. What that means is that it's going to act sort of like what a human scribe would do. It's going to listen to the conversation. It's actually going to do a live transcription, so it's not going to save a recording of the conversation. And that question sometimes comes up when like the patient might ask, or for compliance purposes, but it won't save a recording. It'll do a live transcription word for word what is being said by you and the patient. You sort of have it running on the background during your session. And then using that transcription, it's actually going to generate a note and any other kind of downstream documentation.
And the way that it does that is using the AI, it categorizes all the information in the transcript, it contextualizes it, and then we give it a set of instructions, which we call a template, and we tell it through what sections need to go where, what content goes in each section, what format do we want for each section, and then that note gets outputted in a matter of seconds. This means that the instructions we can change completely. At the end of the day, we can make any type of downstream document, say a referral letter or a patient explainer. And it also makes Heidi super customizable, because the note that you're trying to generate might look very different or slightly different than one of your colleagues. And so you can have, you can apply that type of customization to your templates. And the workflow is pretty straightforward. You can access Heidi on multiple devices. You'll have it transcribing on the side. You would conduct your session just as you normally would. It's going to listen in. So just keep in mind that Heidi has ears and not eyes. So anything that you're seeing or thinking that isn't being verbalized, it's not quite catching. And then once you're done with the session, you'll just be selecting which type of note you want to produce, and then it'll show you the notes completed. Maybe we could go to the next slide, Raymond. As I mentioned, you can access it from multiple devices. So we've got a mobile app, which you can download. We've also, you're able to access Heidi on the browser just by searching heidihealth.com. So you can access it really from any type of device that has a browser and a Wi-Fi connection. And then we also have a desktop app that looks very similar to the browser. The real difference there is that you can use it for telehealth using headphones. So the browser works for telehealth too, but the desktop app allows you to wear headphones and for Heidi to pick up what the patient's saying that's coming through the headphones. And the way that we've been running this, if you're interested in accessing Heidi, if you haven't already, you can reach out to Raymond and his team. They can send out an email invite. You'd receive an email invite to your email. You'd click on it, you'd create your account, you'd automatically be placed into the Cambridge North Dumfries OHT team. And then you're good to go to start using the team templates, start making use of all the different features that Dr. Wilson will actually show you in just a short while. Any questions? I think it'll all make sense as well as Dr. Wilson shows you his workflow. So happy to keep questions to the end, but if there's any pressing items, then feel free to say. Alrighty.
Great.
Dr. Wilson, to you.
Awesome. And I'll stop sharing, so I'll let you share your content, Dr. Wilson, and I'll keep an eye out on the chat as well. So if any questions come in, anybody can use the chat feature, and I'll keep some tabs on that, or just click the raise hand function, or just start waving at your screen and I'll hopefully see you, and I'll kind of interject at that point. But awesome. To you, Dr. Wilson.
Just feel free to interrupt. Everyone can see my screen okay?
Yep.
Okay, good stuff. Yeah, so thanks for having me. Obviously super excited to be here as well. I started using Heidi probably in the fall of last year after trialing some other AI scribes, and just I think fell in love is the right word, to be honest, and have been using it since then. So just what we're going to talk about today, why I use it and why you should too. My workflow in the office, so I've sort of tailored it over the last several months to get to a place where I'm really comfortable with how I operate. Some tips for like when you're in the room actually talking with a patient to get a note that looks like a note you would produce, and then how you can get that note to look like that using templates and the context button, as well as some cool stuff with the Ask Heidi Anything button. I use that quite a lot in the long-term care home I work in for med reviews and things like that. And then we're going to go through a demo, a WSIB case, and a template that I use for that. That sort of will show you how Heidi works, but also how the template function can do really cool stuff. So Why AI? This is a picture of the office that I'm currently sitting in, and that is a piano there that I now practice because I have so much more free time. I'm not very good, and my office partner will attest to that, but that's one of the main reasons that I use AI. But, another thing is that it produces just more accurate notes. So when I was first using Heidi, I would sometimes like show the patient what it did. And, I remember this one consult where the patient had like sprained their ankle at a hockey game, and they, in the note, it said that they used a hockey stick as a crutch. And I thought that that was just some like crazy AI hallucination. So I mentioned it to the patient, and they stared at me like I was crazy. And they said, no, I told you that. And it like dawned on me that like it's not only incredible from like an accuracy standpoint for keeping track of what patients say, but also like it contextualized the fact that using a crutch as after an ankle injury actually kind of meets the Ottawa ankle rules and was clinically relevant. So I always check my notes afterwards after you have it produced, but generally I find it's very accurate to the consultation. The other reason is it just saves so much time. But the thing I really didn't appreciate was like the mental energy that is saved by not having to try and type a note at the same time as talking to a patient. I just find I have so much more to give at the end of the day and during the day. I can stay on top of my inbox messages better. I don't know if other users have found this as well, and I'd be interested to hear, but I don't like skip the inbox messages that are going to take me more time, and they just get pushed to the back, and then all of a sudden they're read for days on end. I just get them done. And the other thing is that it just improves patient care. So you have better patient interactions. You can take a better history. Patients have commented on how you're more engaged and listening. You're not typing on the screen. Your referral letters are better. I highly recommend using it when you're doing like a referral letter to a psychiatrist. You can actually talk to the patient about the medications they've used in the past, and you can sort of use the chart to talk about the medications they've used in the past, and it ends up in your psych consult. And then you're not, having a psychiatrist prescribe something that was prescribed 3 or 4 years ago. You get these really cool patient summaries and plans that can give a lot of complex information to a patient so that they follow the plan, or at least they have a better chance of following the plan. And at the end of the day, I'm just like a regular user that's been using it a lot since the fall. I think, when they posted it on the WhatsApp group, like expert, I got really nervous, and I was talking to my wife about like everybody thinks I'm an expert, but I just keep telling people to use it because it's so great. And she sent me this text from this inspirational speaker she was just listening to that was, I'm paraphrasing now, but sometimes the best thing to do is find a colleague that's having success, not an expert, but having success. And I thought about that for a minute and thought, am I having success because of Heidi? And I absolutely am, because of the amount of time we're saving, the better patient interactions, just the better patient care that we're providing now. So just moving on to the workflow piece of things. So, obviously we need to get consent. I think a lot of us were like verbally consenting for a while, but, I think it's expected now that we get written consent, just like we got written consent for, emails back when we were first gathering that 7 or 8 years ago. So what I do, Heidi has a really nice consent form on their website. I think Camilla has posted that on the WhatsApp group, but certainly we could maybe even post it in the chat group here a little later. And so I just print that off, and I have the secretary at the front give it to the patient. Sometimes there's some questions, so I always make sure that when the front staff gives it to them to sign in the waiting room, like on the plastic piece that you can write on. clipboard. I make sure she doesn't use words like listens and records. Patients really don't like those words when it comes to AI. And I just make sure they will comment on the benefits. And then, you know, it's so rare that I have a patient refuse. I think it's happened once, and it wasn't a patient of mine, it was in an after-hours clinic. But if there's questions, I always make sure I focus on the benefits, so improves care, saves time. But, you know, just talking about the PIPEDA complies with all government regulations. They really like to know it's transcribed. And the other thing I've found for the really reluctant user is just mentioning that, like, Heidi and my EMR are not connected in any way. So, you know, we never use full names, so that AI doesn't know who you are, that transcription doesn't know who you are. I copy, paste, put it in my chart, and then it's deleted at the end of the day. So just for, you know, tricky conversations where patients are reluctant. And in terms of my workflow in the office, I did use just a dedicated desktop for a while, but I had a colleague mention that they use a laptop, and so I tried it with my MacBook, and I use the MacBook every single time now because it's much more portable. I keep my desktop screen open to look through the chart if I need to find some imaging or something like that, but I use Heidi on the laptop. The reason I like that is twofold. One, you know, Heidi's really good, and I'll show you guys in a bit, with templates for exam findings, but there's some exam findings we're just not going to talk about out loud, you know, like that, you know, fungating mass is, you know, probably not something we're going to say in front of a patient. So I like being able to leave the room and keep Heidi running, or if the patient's left the room, you know, being able to go back to my office and just quickly sort of, you know, say that my exam findings into the laptop. The other really helpful thing is the context button. So this is a thing that you can click on and give some context to your visit. So this is a follow-up for this patient who was admitted for PCI 2 weeks ago, and they're following up on their medications. It just helps Heidi craft a nicer note. I like being able to talk to that before I walk into the room, and the laptop just gives me that, like, portability aspect of things. So a couple of things about the consultation itself, and Allegra already touched on a few of these things. So I have a nurse, she takes my initial history. I always just repeat that really quickly. You know, it saves the patient from having to repeat it, but it also sets the context furthermore for the note that Heidi's going to make. And then, you know what, like, I take a history now like they taught us in med school. Like, I focus much more on what the patient's saying. I often signpost a lot more. So, you know, I'll say things like, we've talked about your runny nose, but I'd like to know a little bit more about that crushing chest pain you mentioned. I find that helps, you know, make your note really nice. The other thing that's really important is summarizing and specifying. So, you know, just like Allegra said, Heidi's not going to know if it's the right shoulder if they're just pointing to it, or you know, when they talk about radiating pain, they'll use their hand to describe how the pain's radiating. I'll summarize that for them so that Heidi picks up if it's right or left or whatever. You know, I find this, you know, is great for, like, that relationship when you're talking with your patients, but it does help with quiet talkers. So sometimes patients are really quiet and the MacBook mic doesn't pick it up. It's not common. And same with accents. And again, Heidi's really good with accents, but sometimes if there's that combination of quiet and an accent, it might not pick it up perfectly. Any questions? I haven't given a chance for anyone to ask any questions or comments or anything like that. Oh, okay. So,
would
yeah.
work as well. Like an iPad, you think that, because they've got now the huge PowerBook iPads, those probably would be pretty good as well for going around with.
Yeah. I think I like being able to type, and you know, I already had this MacBook previously, so yeah, I think an iPad would probably work as well. I think you can. Depends on your EMR potentially, but it's and the way I've crafted my templates, it's a really quick cut and paste job, so that there's minimal sort of work to it. But yeah, an iPad would work too.
So, hey Adam. How do you transfer your note from your MacBook to your computer?
Yeah, so
EMR.
I run PS Suites on the MacBook as well.
Okay.
Yeah. So it's running. The only thing you have to make sure you do is make sure the note is up to date when you go back into it. Like if you have them both charts, you can have both charts open at the same time, desktop and MacBook. You just have to make sure you in the top right corner of PS Suites, if the chart is changed, you can reset it. And it just saves you about a half a second. Because if you don't do that, you'll get a warning saying that it's not the chart.
It means that we can't use it on our mobile phones, no? Because it won't be possible to transfer the note.
Yes, so if you are using the mobile phone or an iPad to conduct the session, you can then go back to your desktop. You'll log into Heidi via HeidiHealth.com or on the desktop app, and whatever you performed on the mobile phone or on the iPad, because it's the same account, you would just hit refresh on the computer and you'll see those sessions populate. And that's how you would transfer over from one device to another.
Thanks.
Yeah, I think I do it like this. Like I considered that. I think I do it like this because I really like being done with everything as soon as the consultation is finished. So I copy paste bill and it's done. And then, it just feels like, a more streamlined process for me, but I'm sure that would work as well.
And what happens to the raw data which is generated? Because there's a context to it. I have used the Scribe AI. So when the raw data is generated, that does not differentiate between the voice of the doctor and voice of the patient. So I don't know that may be interfering with the generation of a note or not, and that may have some medical legal implications because it is not exactly differentiating between the voice of the doctor and the patient. I don't know about the Heidi.
So Heidi, it does the live transcription, meaning that you're correct. It won't differentiate between like the tone or the pitch of the voice, if there's like multiple patients in the room or if there's a doctor or patient, but it does contextualize the information very well. So and I would just encourage you to try it out and see it for yourself because it will figure out who's talking. When there's multiple patients in the room, it's a little different because you have to sort of guide it and give it clues where you might say, "Hi, Tom, tell me about this," and then, "Oh, and now you, Nick, please talk to me about that." If the patient's coming in with, let's say, a family member, then given that the family member might be saying, "Oh yes, she hasn't been feeling so well," Heidi will contextualize that pretty well, and we can help it and try to get clues so you can verbalize who's speaking or try to guide it a little bit. Or in the context, you can actually also type out and mention sort of the setting and who's in the room. But I think you'll find just by trying it out that it does a good job at differentiating who's speaking.
So can we retrieve that raw data if some medical legal problem is there?
Yes, so once Dr. Wilson maybe shares the screen to show you the product, you'll see there's a transcript. So for each session, you can actually see the transcript and you can see everything that Heidi transcribed and what it's using to build the note. Because the session's in your account, it's got to live somewhere. So it's actually in a Canadian server. But once you delete the session, that will delete all the content, including the transcript, the raw data, and you actually can't retrieve it. But as long as it's in your account and you can see it, then it's there for you to reference if you need to.
Thanks.
It's hard for me to imagine a medical legal situation that would arise from that and then them asking for a transcription. I think like at the end of the day, at least my experience and my colleagues' experiences have been that our notes are way more accurate and way more reflective of the visits typically. So yeah, it hasn't been a concern of mine, but I think it's new for everybody, so I can appreciate that concern. So I'm going to just exit my talk and open up Heidi here. All right, there we go. Yeah, so this is the product you'll see. This is the browser version. So in terms of what I was going to chat about today was I'm going to go through a generic runny nose.
Oh, he may have removed access from where he was sharing in Microsoft Teams.
Oh.
It might be worth emailing because maybe he won't realize because it's not so obvious.
Okay.
It's happened to me before, and I just speak for like 5 minutes till somebody tells me.
We'll just send him a message really quick. Oh, he's back.
Back.
Oh, you're muted now.
Okay, I could hear you guys saying something bad happened, but I didn't know what that bad thing was.
Oh, so you could hear us.
I can hear you, yeah. Can you guys see my screen?
Yes.
Yep.
Okay, right. Can you see this now?
Yes.
Yep.
Ah, beautiful. Okay, we're back and running. Okay, so yeah, so this is the product itself. So I thought what we'd do first is just go through this is like an after hours clinic that I did with a staff member earlier. This is like the, after you take your history and do your physical, this is the sort of template generic note that you would get from Heidi, right? So I typically use, if you look at this where it says custom there, this is how you can adjust the level of detail of your note. I typically use Goldilocks. Sometimes for like mental health visits or more complex things, I will use detailed. And I typically use the standard. So I think this used to be right and left brain, but I use the standard versus the extended sort of note. Some people I think feel more comfortable including more detailed, so you can click extended and more detail. But anyway, so when you're examining a patient, what I used to do with Heidi previously I would say to the patient, oh, your temperature's 39, your pulse is 110, oxygen sat's 96, weight 20 kilograms, your ears look normal, throat was normal, chest sounded clear to me, your heart sounds were normal. I would just say these things out loud, but then you'd have to sort of leave the room and then dictate a little bit further to, if there was any, positive exam findings. And I, never really liked how it just said NAD. I think that sort of lacks the detail that is expected, for our notes. I also didn't like how it would include past medical history there. I feel like that's pretty redundant in our clinics with the EMR. So I used a template. And so the way you use templates is if you go into the template library, you can see lots of templates that people have already crafted. I've made the templates that I've made available, I believe. So the one that I use for my consultations in the office is it's the SOAP issues custom CMA. I always wanted to have notes that had issues, where you'd have.
Oh, Dr. Olson, I think it happened again, if you can still hear us.
Oh, it keeps kicking me out every time I go into Heidi. That's interesting. Okay. When we demoed it, that didn't happen. Yeah, you can hear me now again, presumably?
Yes.
Okay, all right. Yeah, so as I was saying, I always wanted to have notes that had, separate issues organized. And so in this consult, you can see, the mom mentioned that there was a recent wart on the foot and resolved with over-the-counter treatment. That was sort of put in past medical history. There's a previous hospitalization for appendix, no asthma or breathing problems. So I never liked how, again, the past medical history sat there, and I didn't like how the vitals sort of were put throughout the note like that. So I made my own custom template, and I'll go back to my template in a second. But now when I say something along the lines of, oh, your chest is clear, I actually get chest clear, no wheeze, no added sounds. If I say your ears are normal, I get your TMs are normal, cone reflex present, no exudate, no edema bilaterally, no tonsillar exudate, erythema, or hypertrophy. So my note now is much more robust and sounds much more like me. I don't have that past medical history bit in there, so it's just sort of the things that we had chatted about. And, you know, I've got my 2 issues, right? Issue 1, issue 2. So when I crafted that template, I just went into another template actually, and I just started fiddling around with it. And the team at Heidi is really good helping you try and you know, get your template to do exactly what you want it to. So if you just tell them, hey, this is what's happening and this is what I want, they'll sort of go in and adjust it for you and give you a hand there. So Allegra, you know, helped me with some of the things here. So, you know, one of the things I didn't like was if I said, oh, your throat is a little bit red, it would include the word red in the examination. So I changed it to, if I use the word red in the examination, use the word erythema in the adjective section. And now if I use the word red, I get erythema in the note, which is really nice. So the other thing that I love templates for is...
I was going to warn him. Dr. Wilson happened again. Okay.
I think it's
when you
when
click the microphone. Oh, wait, you're on mute.
I can tell when it happens right away, so I will I will stop doing that. Yeah, so when the other thing I really love is the summary thing. So my summary template. So I just made a template in the template library. So if we go to my summary with guidelines, I just asked it to make a patient-friendly summary note about the plan, include up-to-date guidelines about and advice about the problem, and if applicable, red flags patient should go to the hospital for. So when you go back to my runny nose session,
You're back.
yeah, okay. When we go to my runny nose case, this is my note that I can then give to the patient, right? So your child has a viral upper respiratory tract infection. It outlines the treatment, the current guidelines for respiratory infections, when to follow up and when to go to hospital. And that's something you can just like give to the patient, which is really cool. Another there we go. It seems to happen if I switch. Yeah, that's when it happens. So another example is a hypertension follow-up that I did, and you know, I find the summary with guidelines and summary with plans really helpful for those like complex medication change appointments, right? So like we're all switching people from chlorthalidone right now over to indapamide or some thiazide-like diuretic. And so, you know, having those conversations with patients and then just sending them into the fray without any other information. I used to like handwrite a note, but now, you know, I can give them this really cool patient summary. So, you know, this is a patient summary that is just my template for the plan itself. So, you know, continue ramipril, switch from chlorthalidone to indapamide when your supply runs out, complete your blood work in 2 weeks, call if you experience these symptoms, and we'll let you know about the results. You know, if I want to give the patient advice about hypertension, you know, I've given this note. This is summary with guidelines, lifestyle recommendations, when to contact the office, hypertension guidelines, red flags, and when to go to the hospital. And you can, you know, use these templates in any way you want to give, you know, that patient that added level of patient information, which has been really cool. The other thing,
Dr. Wilson, can I ask, for the patient explainers, the patient summaries, what are you doing with those? Are you printing them out and handing them to the patient there in the room, or are you putting them into a patient portal of some kind?
Great question. So it depends on the patient, right? So sometimes I'll print it if it's an elderly patient that doesn't have email, and I'll just hand it to them. And often they'll have their like binder of things, all their like past blood work results and stuff like that. If it's a patient that uses email, I'll just email it to them. It takes like a few seconds, right? Yeah, so it just depends. I have printers in all the rooms. I thought it was really like saving time when I put printers in all the rooms, because then I didn't have to walk to a single printer, and that was like 5 seconds of saving time. And then like Heidi has come and saved like 4 or 5 hours a week, which like pales in comparison to my printer idea. Anyway, yeah, so that's typically.
We just have a question in the chat from UP. I don't know,
Yeah.
if you want to.
Hey, thanks, Adam, for doing this. Couple questions. So when you were just talking about so you did the initial visit with a patient, use your SOAP template, but then when you're doing these other like patient handout or whatever, then you're actually having to put in another template, right? So you.
Right. Yeah. So these templates are already created, right? So
No, I understand. So, but like you kind of, it's not like all of these are just as like contiguous, right there. You first do your template for the patient, and then you're going to do a template for the patient summary, and you might copy and paste that into that. So you have to switch between the templates when you're doing those, right?
Right. So I would go like, here's my note, right? There's no patient plan or summary. I've just deleted them. I would just go create, and then summary with guidelines, right? And then it would just build it right here. You can do other stuff while it's working away, but it's usually pretty quick. So it's just generated it here. It's done, and then I would just do copy and then paste into my file there. So here's the note for my my runny nose patient. The other thing I did, it seems really simple, but like at the top there, it says subjective in the original template. I got rid of that up at the top here. So it no longer has subjective, so that when I go copy and I go into my patient chart, all I have to do, there's my nurse's little saying. All I have to do is highlight and then copy and paste, and it's in, and I'm done. And then I'll bill, and that's it. So that's how I use Heidi there.
And sorry, are your templates available? Because in the template, like, are they in the community library or the just template library?
I think my SOAP issues custom CMA one is. I think I made it available. The other ones, I'm not sure. I don't think they're available, just because I haven't made them available, but I will. The WSIB template I've made, I think might be available, but if it's not, I will make it available. And anyone at Heidi listening, Allegra, and you can make them available if you like.
Okay, perfect. I saw that you submitted your the SOAP with issues custom to the community, and it said in review when you were in your template library, which means it wouldn't be in the community yet, but we'll add those templates into the team template across Cambridge North Dumfries OHT then.
Okay, cool. Any other questions? No? Okay, I will move on. Just thinking about time.
Sorry, I'm sorry. One other question for either of you. So you were saying that you contacted Heidi themselves to see about changing any of your templates. Like, we can play around with the template also. Like, if there's right, that we want, like, this is the way I want to do this, we can kind of take that template and make it our own, right?
Absolutely.
Okay.
Yeah, and I say it works most of the time. I like, when I was having a bit of trouble, like, I think it was an easy fix, but all the adjustments I've made afterwards, have quite easily resulted in the thing that I wanted. It's pretty intuitive that way, I would say.
Yeah, and I've been using it for a while too, and I've been through 4 different scribes also, and I love Heidi the best also, and I also find like the one that I can kind of trust the most, where the other ones I was actually like having to edit so much, and actually the last one I was like, I'm spending as much time editing this as I was writing out my notes before, all of this. This is I'm just curious about your experience. Have you found you've gotten to the point where now you can trust it so much that you don't even need to like go back and really look at what you've written?
Yeah, I think there's this really interesting thing that happens in all fields of things where you can become an expert, right? And so I think there was a point where I started getting really good notes, and I got a little bit like, oh, I never need to check these. So I kind of got a little bit lazy and
Right.
not checking them. But then, once in a while, you'll get something, right? So I think, one thing that happens when you have these normal sort of objective results, examination findings, once in a while, it'll hear something that it thinks an abdominal exam was normal, but actually you didn't do one. It's not common, but I think it happens enough that you really should check your note every single time.
Okay.
It's so good that there is the temptation not to do that, but you definitely should do that, right? And I think the college would expect us to do that. But yeah, it takes like 5 or 10 seconds to read through a note. How much time did we spend sitting there writing our notes previously, right? Like there's no comparison from a time standpoint, I would say. So yeah, just in the interest of time, I think I'll crack on to my next little bit. So I just want to pull up. Yeah, so I didn't talk about the context button. I will touch on that briefly, even though it's amazing. So the context button is right here, and it's essentially when you press on it, you can that was some context I was trying to give this note earlier, but and I didn't put it in, but you can put anything you want in here that allows Heidi to sort of contextualize the visit, right? So this is a follow-up for X, Y, and Z. And now you can actually dictate into this section. So the other reason I really like having my laptop is because I can hit the dictate button and add information. Yeah, you can now dictate into this and give it extra context. So you can also like download PDF files into this. So that's actually how I developed my WSIB template, which is the thing I think going to talk about next. So yeah, this was my slide on templates, just about how to make Heidi's notes look more like yours, and just make those like referral letters and patient plans and things like that more efficient. So yeah, this is a WSI. I don't know how many people sort of get a little bit sweaty and nervous when they see this thing. And they always seem to tick all the boxes down the side. These are really time consuming and, not user or patient friendly. So I actually put this PDF capture into the context button and asked Heidi to create a template for me. And so essentially I have built a template around this report. So I was going to do a patient history with Camila, if she is there. If you want to unmute your mic. Are we there?
Yes, I'm here, Adam.
Yeah, good.
Can you hear me?
Yeah, I can hear you. So we did try this earlier and it totally worked, but I am worried about the microphone thing that's been happening. So fingers crossed this works. So we're just going to do a
I think you should be back in a sec.
Yes. Okay, so we're going to do just a quick patient sort of interaction here, and then I will build a WSIB note, and it'll give you some idea of how Heidi works. So
I was gonna say, because you could see the microphone had the red square around it, meaning that it wasn't connected.
okay, everybody hear me?
Could you
Is this
click
working?
around the microphone? There's that red box, so I don't think the microphone is actually connected. Could you click the arrow to the right of the microphone? Yeah. On the right hand side, yep.
Right here?
Yes. It might be because you're either sharing screen or on your call, but I guess you tested it before.
Oh, we totally tested it. Raymond, it worked, right?
It.
Okay. It looks like it's
It
connected.
would be green though if it was picking up.
Okay.
Oh, it looks like on your browser, like where it says Heidi dash platform,
Oh,
there's
yeah.
a little microphone icon at the top of the browser. Do you see?
Where? Right here?
Just below that.
Yeah.
Yeah, right there. Like I wonder if, but I think it's almost like a privacy permissions thing that Safari is doing. You blanked out now.
See, I told you I'm not techie. There we go. All right. Is that working now? We're good?
Yeah, we can
Yeah.
see you.
Okay. Now,
No, we lost you again.
okay. Well, it looks like we can't run it this way now. Okay. That's too bad. That's interesting. Any suggestions?
Not that I can think of. Like maybe it's some Teams setup. I'm not sure.
Yeah, it totally worked this afternoon. So maybe what I'll do is just show everybody the template, and everybody's heard a history and a physical before, so I don't I don't know how helpful that would be anyway. So okay, so my WSIB template, essentially what I would do in the consult is I would go.
Oh. Maybe. I don't know why that's happening every time now.
Yeah. Okay, you guys can hear me though?
Yeah.
Yeah, okay. So essentially what I would do is just take a standard history and physical, and just make sure I touched on those points about like range of movement and all that sort of stuff. And I would just ask, I would just hit create template. So yeah, I would make sure I touched on like proposed treatment and prognosis, and you don't really have to structure it exactly like that, but just talk to them about the plan, and make sure you include range of motion and current medications and all that kind of stuff. And then you just hit create template, WSIB template, and it makes this incredible note that you can just send to WSIB. You attach the imaging and the consults from the orthopedic doc or whoever it is, and you send it. And the whole process, when you have a patient in the room, honestly takes about 10 minutes, and you've sent that note off. It's pretty incredible, actually. So any of those like routine tasks that you have to do over and over again, you can build a template for. So yeah, so that's what I've done with this one. The Ask Heidi Anything button, I don't know if anyone's in long-term care, but essentially, like, think of a problem and think of like something you don't like doing in your everyday clinical practice, and ask Heidi to do it for you. So one thing that I have to do are these QMR quarterly medical reviews, and I have these like lists of drugs, and the number of times I've looked at this list of drugs and actually missed a drug because it's buried within a bunch of bowel medications or medical orders. It's been really hard to sometimes follow this and get a very clear and organized sort of note, or just being able to like care for a patient when you're trying to look for medications. So what I do is I go to Heidi, and so if I'm in a session, I will just
Oh, Dr. Wilson, it broke again.
There we go. You can hear me now? I like how you
Yeah.
said that. It broke again. Okay, so please categorize and organize the following medications, etc. It's always important to put etc. and leave their indications and dosage. And then I would just paste all those drugs in there, and it has, you know, dates and all sorts of stuff that you don't need to know. And then I get this incredible list of drugs that is easy to read. So my diabetic drugs, cardiovascular drugs, the GI drugs, pain, neurological, psychiatric drugs. And now I can use this in my clinical practice, but I can also, you know, put it in a note. I've had patients at the you know, other physicians at the long-term care home say, oh my gosh, your quarterly medical reviews are so amazing now. The other thing that Heidi is really great for is those like complex conversations with family members. You know, just using it to transcribe, and you can ask Heidi, please make a note, advanced care planning discussion note, and it'll craft this like beautiful note that you know, summarizes really complex conversations about DNRs and advanced care planning. It's been pretty revolutionary for my long-term care practice as well. So yeah, those are some ways I use Heidi. It would have been cool to go through the demo, but I think, you know, all you got to do is try it with a patient. And honestly, just use my WSIB template, and it'll work for you for sure. So yeah, so I mean, we talked about a lot of things, but you know, we went through my workflow, some tips. You know, definitely go out and use those templates, and just like you know, try them. Like run a consult, and then make a change, and then just run it again, and see if you get the outcome you like. That context button is super cool, and yeah, the Ask Heidi button really is pretty neat for lots of different things. So yeah, I hope you guys enjoyed the chat, and maybe we can do a Q&A now. I'll maybe stop sharing my screen, and we'll go from there.
Thank you. There's actually a question from Dr. Camila. What are some other examples you can ask Heidi to use it for anything else?
Yeah, so I was talking to Tom about this in Toronto, and you guys are gonna bring back the like clinical question stuff, right? Because I know it kind of like, there was a while there where I was using it for like, you know, dosages and things like that, but it doesn't let you. Are you guys like working on bringing that back?
It's slowly and in a thoughtful manner, because there are like compliance aspects to asking it for recommendations. And
Right.
It really should be like suggestions, and it's referencing a specific type of document, or maybe like up to date, for example. That has come up recently, to try to figure out how to embed it within Heidi, so that you can also maybe, it can surface some of the most relevant information.
Other things I use, I will like ask it to do something. Like this afternoon, I had a conversation with a patient that had mild cognitive impairment, and they wanted their daughter to know the conversation. And so I essentially just said, hey, Heidi, please write a letter to the daughter explaining today's consultation and what our plan is. And like, oh my gosh, it just gave me this incredible note. And I just emailed it to the daughter, and it just saved, you know, it saved me a phone call. You know, it saved like that patient having to come in again, like with their loved one. It was incredible, right? Like, yeah. And obviously, like, you consent the patient for that sort of stuff. But yeah, I mean, I use it for that. Yeah, you can get it to write referral letters. I use it for that. It's especially useful for like the acute emergency referral letters, like ER referral letters, you know, stuff like that. You know, I definitely use it for referral letters quite frequently as well. I think the older we get in practice, like the shorter our referral letters get. So then my next project is to work on a template that makes shorter referral letters. But yeah.
And what it is quite nice for referral letters is that if the patient came in with, let's say, 2 to 3 problems, one of them being like a stomach ache, if you ask Heidi in the Ask Heidi bar, write me a referral letter for a gastroenterologist, it will do very good at sort of focusing on the relevant information for a gastroenterologist and not mention the other sort of irrelevant issues.
Yeah.
It's worth a try.
Yeah.
I know we're at 6 o'clock, but if there are any like last minute questions, and then I do have just one slide on next steps for those of you that have not been set up yet on Heidi. But I'll just see if there's any last burning questions.
Anything that people
Yeah,
use?
sorry, just about the referral letters. So do you do it just from that visit, or do you actually dictate anything in a referral letter? Like, sometimes when we're composing a referral letter, sometimes there are things that we want to add from, previous knowledge. Do you use that, and how do you do that?
That's a good question. I sometimes I will just dictate into Heidi like the thing that I want it to do, right? So, patient has a past medical history of this, that, and that, and I'll do that when I leave the room, to do the referral letter. So I think probably now you could use the context button to dictate that in, now that context has a dictate function. I don't know if you could speak to that more, Allegra.
Yeah, and actually this week we released a dictate everywhere function as well. So it's not only dictating into context, but let's say you ask Heidi to generate a referral letter for you, or generate it for you, and then you wanted to add an additional section. You can actually just place your mouse on whatever area of the letter you'd like to dictate into. That'll be that little microphone, just like Dr. Wilson showed you, that was in the context. It'd be on the note itself, and then you could speak to it and dictate a certain section, and then you would copy and paste that over to your referral letter.
It's like you guys were reading my mind. When I got that email this morning, I was like, oh my gosh, this is perfect.
Yeah.
Okay, I just want to if you talk to a patient during the encounter that I will send a referral to gastroenterologist, will the Heidi write a letter from that conversation and send it to?
It won't send it, but it'll make it. It will make. Yeah, you just use one of the templates, the referral, or you could even in the Ask Heidi Anything button, please write a referral letter to so and so. I like the templates because you can. If you just go to my template library, I got rid of a lot of the stuff on the template. So this is, there's no address or dear whatever on the top here because Practice Solutions or PS Suites already does that for you. So this is my template for referral letters, and it keeps it nice and clean and short. And then you just paste that into your EMR and you send it as you normally would, right?
So does that mean you have to like restate all your past medical history? Because a lot of times that's already like a template done, or do you kind of from every time you have an interaction that you're going to cut and paste?
I think everybody does their referrals differently, right? Like if there's a past medical history that's relevant, I would probably just speak to it or dictate it in now that we can do that. Or really, I think most of us just say, please see attached CPP, and then, there's your past medical history in the CPP, right? So that's typically what I would do.
What other providers do also is use that context to maybe paste the previous session's note that might have a summary of that past medical history or additional context for the patient. And then Heidi will bring that over as a context for the visit and for the referral letter.
Yeah, I have someone that actually told me they would paste the previous PHQ-9 that the patient emailed to them before the session, their like mental health session, and they put that into the context and then build their note around that, which is pretty cool. I haven't tried it yet, but
cool. I'm going to steer us to a close because we are a couple minutes over. So again, want to thank both Allegra, Dr. Wilson especially, for going through kind of how he's been using Heidi on a day-to-day basis and going through some of those tips and tricks. If you have not been set up yet, I just took over the screen, sorry. If you have not been set up yet, would like to get set up, please send an email to this digitalhealth@cndoht.com, and I can connect with you and make sure you get set up. Or if you'd like another individual training session, we can coordinate that with Heidi. I'll also kind of go through the list to see who's attended and who hasn't been signed up yet, and follow up with people that way. But do appreciate everybody taking the time in their evenings to listen to the discussion. Again, really appreciate Dr. Wilson and Heidi for attending. And with that, I will kind of close out the meeting. So thank you again for everybody for joining.
Thanks,
Cheers.
Raymond. Thank you, Dr. Wilson. This has been amazing.
Yeah, my pleasure. Thanks.
Great. Take care, everybody.